According to health officials, the country remains COVID-free, and this has been attributed to a couple of factors. In an exclusive interview with Acting Permanent Secretary in the Ministry of Health, Dr. Francis Martin, he indicated that they were able to accomplish this based on certain mechanisms they already had in place that needed strengthening.
I think the main reason is because we had some semblance of what we needed to do when the COVID pandemic hit the world. We were not starting from zero. We had an existing pandemic plan that we needed to have just tweaked to be able to accommodate for what we were facing with the COVID. So we used that and recognized quickly that surveillance, and in fact, port surveillance was the main area, one of the main areas for us to start putting efforts into. And I think that bore fruit because we were able to identify our risks very early and were able to have the proper mobilization.
Illegal border entry remains one of the challenges faced on island. However, P.S. Martin says they have taken steps to guard as much as possible against it. He highlighted some of the dangers they were able to avoid as the virus continued to spread in neighboring islands.
One of the pitfalls that we were able to avoid is that of deaths. Having seen what was going on with the deaths across the world, we took some actions and some decisions that we've made to manage our hospitalized patients in the way we did, and that caused us to have zero deaths. And that's because we probably chose to manage those patients outside of ventilators, for example, and use oxygen and other methods. So also able to avoid the pitfall of widespread infections and epidemics because we had very aggressive contact tracing with our teams going out and meeting people, and not just meeting them, but testing them and ensuring that their status was known, and we did what we had to do with that.
With schools and borders now reopening, P.S. Martin says it's doing so in a safe enough manner to avoid widespread infections and community transmission. The phased approach for schools, he says, is probably the best method at this time.
Now, the potential area at risk in this present iteration, to my mind, is two. One of it is reintroduction of COVID into Grenada. And that is a very real reality, because as we open our borders, and certainly as we increase on the number of persons coming in and the commercial flights, that definitely increases our risk of reintroduction of COVID. And so this is where we spend a lot of time now discussing and thinking at all levels, at the committee level, at the stakeholdership level. How do we mitigate for the reintroduction of COVID into Grenada?
Christina John, GBN News.